Have you experienced back pain before?
Does it affect your day-to-day life? Do you think surgery is the only solution for chronic back pain?
Are you scared of dying because of persistent low back pain? Greetings, ladies and gentlemen. Today we are going to uncover the myths of low back pain and bring you the facts regarding low back pain that can change your life forever.
Hi, I'm Chong Xiang.
Hi, I'm Wan Ying. Hi, I'm Min Lee.
Hi, I'm Marina. Hi, I'm Wanzi. We are students from the National University of Malaysia.
We hope you enjoy the video. Camera, action! I've been suffering from back pain for a long time. I even hardly do gardening that I love just because of the pain. Akira, living as an older people is so boring. When you age, you'll know my feeling.
Grandpa, do you really think that getting older is the main cause of pain?
Yes, all of my friends are suffering from this as well.
Believe it or not, I actually got back pain 3 months ago.
Huh? Really?
Back pain is not an inevitable part of aging. Although there is a widespread belief and concern that getting older will definitely cause or worsen back pain, it is actually not true. Back pain can originate from motor vehicle accidents, sports injuries, or otherwise abrupt causes that may eventually lead to muscle strain, ligament sprain, or spinal irregularities regardless of age. Sometimes, the presence of persistent back pain when we age could be just due to incomplete healing of the previous injuries on the back, as the pain will only start to show up progressively when the structures become weak to cover the hidden problems. Therefore, the better care we take of it while we are young, the better chance we will have to avoid the aches and pains of aging. Besides, interestingly enough, living a sedentary lifestyle is in fact a leading cause of age-related back pain. Older people tend to avoid frequent bending of their back as they think that the spine is too fragile to be moved. However, exercising in the proper techniques, as a matter of fact, is the best way in the prevention of back pain among the elders. In a nutshell, aging is not the cause of back pain. Back pain can occur in any age group, and it is preventable no matter how old you are.
I've searched the internet to know more about the treatment for my back pain, but it doesn't help at all. Dealing with back pain is really annoying.
What have you done? Did you do it in the correct way?
I previously thought that my back pain was probably due to poor posture at work, so I tried to maintain an upright sitting and steady posture at all times because it was mentioned in the website, right? And this is supposed to relieve the back pain, but the pain is still here.
Maybe proper posture is not the right way of treating it. I think it's better for you to get some treatment or advice from the professionals.
We are usually taught or advised to have proper posture such as sitting upright and avoid slouching at all times, even though it is actually uncomfortable for us to maintain it. This is because poor posture is thought to be the factor that causes increased loading on the spine and back pain. In fact, evidence has suggested that the link between poor posture and back pain is weak. Back pain is not caused by poor posture, as there is no single correct posture. It may seem hard to believe at first, but the reality is the discomfort and the pain that we experience from the back pain is not due to tissue damage. Instead, it is related to our lack of movement as we are made to move. Besides, prolonged postures will eventually trigger muscle tightness, which results in back pain as well. There are varieties of postures that are safe for the back. It is good to relax during everyday tasks, even if we sit with a round back, in order to give our muscles some rest. Moreover, it will also be more efficient in preventing back pain when we avoid sustained posture. Therefore, we should change our posture frequently rather than staying in one position, as the best posture is the next posture.
Oh, my back is so painful again. I have to take stronger drugs to control the pain. Oh, maybe I should go for surgery too. Oh,
Stop! What are you doing?
I just want to take more pills to take my backaches away.
You shouldn't take the drugs without the physician's prescription.
Why not?
Injection, surgery, and strong drugs are effective treatments for persistent back pain. Medication only gives temporary effects on relieving pain. We should not rely completely on painkillers in order to recover from lower back pain. Also, we should never take any medicine without a prescription from a physician. Researchers say that instead of taking medicine only, doing exercises and having an active lifestyle are also important to relieve the symptoms of back pain. So, when will surgery be done? Surgery will only be carried out if someone fails to recover from conservative treatment for at least 6 weeks.
Hey, it's already 12 noon now. Why are you still lying on the bed? You should do your household chores.
No, I don't want to move.
Hey, it's time for some exercises. Do you want to go with me?
No thanks.
I'm so tired. Oh my god, you have been in bed for almost a whole day. Are you feeling sick?
I was staying overtime yesterday to finish some tasks in the office, and my back is so painful. I think I have to rest for a few days.
Being physically inactive will not cure the back pain. At the same time, being physically active will not worsen your back pain. Staying in bed or being sedentary for a prolonged period will make you stiff and increase the pain. So, we should maintain an active lifestyle even if we are having back pain. There are some exercises that can be carried out during the back pain, such as swimming, brisk walking, and cycling. So, don't let the pain to affect your daily life. My back is hurting so much after bending so many times to carry all these boxes.
Do you need to have a seat for a while?
I think I need to go for a scan at the hospital. I'm afraid I really injured my back just now.
People usually think that frequent and repetitive bending and loading is bad and harmful to our back. In fact, it is actually not. Activities that involve bending and loading, such as lifting weights, makes muscles stronger, while activities that involve moving and loading makes the back stronger and healthier as well. The bending of our spine is basically an unavoidable movement in our daily life, as most of the activities we do will involve trunk flexion. Our back is a strong structure. Movements such as lifting, bending, running, and twisting are safe if they are started gradually and practiced regularly. Therefore, we should not be afraid to carry out repetitive bending and loading movements of our backs, thinking and afraid that they will bring harm and are bad to our backs.
Ah, doctor, I don't think this treatment is right for me. It has so much when I bend forward.
Miss Day, don't worry. This exercise is good for your back pain.
Are you kidding me? This movement aggravates my back pain so badly. It will definitely make things worse. I'm not going to do it.
The more pain we feel, the more severe the injury is. There are many factors such as joint stiffness, muscle tightness, strains, structural pathologies, or other underlying conditions that may cause back pain. When pain perseveres, it is common that the spine and its surrounding muscles increase their sensitivity to touch and movements. In this case, the pain caused during movements or activities actually reflects how sensitive the structures are, instead of how damaged they are. Meaning the sore caused during movements is actually safe, not that the injury is getting worse. However, even though that pain is aggregated, exercise as an evidence-based treatment is still needed and very important as it serves as one of the most effective treatments. It does not harm and is normal to feel pain, especially when we start to move and exercise. The pain will probably decrease with time when we gradually increase our activities. In fact, continuously avoiding certain movements or postures that cause pain is not a cure to it either. In a nutshell, the scale of pain aggregated does not indicate the severity of the injury.
Miss, your MRI scan is normal. We don't see any abnormalities on the scan. What? Doctor, look properly and closely. What are you talking about? Miss, don't worry. We have inspected this many times, but there aren't any noticeable abnormalities shown. Then why do I feel this pain in my back?
Scans and medical imaging show the causes of back pain. Now, this is actually a very common scenario which happens in our day-to-day life. To simply answer the question, not all pain is detectable because not all pain comes from physical or mechanical abnormalities. People blame the inaccuracy of advanced imaging techniques such as MRI or computer tomography for not being able to detect the physical abnormalities which they suspect contributes to this intolerable pain they are feeling at certain body parts. In Ms. Chu's case, the spinal imaging does not show a noticeable difference from normal imaging. While this does not mean she is in no danger, it does mean some serious conditions suspected can be excluded from suspected diagnosis. Truth to be told, these investigative procedures actually expose people to preventable harms such as radiation and are, needless to be mentioned, quite costly in fact. These investigative procedures are normally only indicated or prescribed when there is strong evidence showing that this symptom is caused by pathologies which need further routine imaging. So you might be wondering, how come it does not show on the MRI? The fact is that most times low back pain can be caused by structures such as muscles or ligaments or even emotional status of the person such as stress, which cannot be diagnosed or seen through MRI scans. And therefore, scans and medical imaging show the causes of back pain? Sometimes, yes. All the time, no. It is simply a myth. Oh, this is the best.
Happy to be at your service.
I thought you were going to give me my 24-hour massaging session.
No, miss, I'm helping you to stretch your hip flexors because after assessment, it seems that the hip flexors is the structures that cause you to suffer from this back pain.
No, I want my massaging session. Give me back my massage.
We aim to provide you with the best treatment in town. Physio for you, always for you.
Now you might be thinking, shouldn't massages be the best way to relieve the back pain? Why isn't the therapist massaging the patient? Well, studies have shown that while massage does provide temporary pain relief, but it doesn't treat the cause of low back pain. Hence, the root cause is still not solved. Low back pain is a symptom which occurs when other structures are damaged or present with abnormalities. Massage improves the blood flow and provides tactile stimulation which resolves the pain for a while but not for long. Do you find yourself aching to go for more massaging sessions and the pain just kept recurring? Now you found the answer why. Then, what is the best way to combat low back pain? Simple, through exercises. According to findings, weak muscles feel the need to strain themselves in order to function properly. When this situation persists, where the muscles keep straining itself, it can cause muscle tightness even though the muscle is in a weakened state. Thus, we could start with some simple warming up and do strengthening exercises for it.
Look, my spine doesn't look like it is straight, does it?
Really? Let me have a look. I think the problem is not your spine, it's your eyes.
There must be a problem with the alignment of the bones of my spine, or else why would I have back pain for almost a month? Cannot go on like this. I need to find another therapist to have a look at my spine again.
Denied.
A lot of people will think that bones being out of alignment is what causes their pain. Some have the opinion that their spinal vertebra have slid to the side, or have rotated, or that their bones are just asymmetrical. Honestly, it would make a lot of sense for one to feel that they are in pain when the nearby bone shifted out of their normal place. However, research has actually debunked this and proven this to be a myth. Having back pain does not mean that there must be something wrong in the alignment of our spine unless we have a dislocation or fracture that is caused by trauma or degeneration. Our spine is strong. It is surrounded by muscles, ligaments, tendon, and other soft tissue structures that help hold our spine in place. These soft tissues are extremely thick and robust. Therefore, this provides our body with resiliency and stability. And thus, the incidence of bone shifting out of place, the rate of occurrence is much lower than we thought.
Just let the back pain kill me!
Hey, what happened?
I feel like the back pain is killing me. I can't even focus on my work.
Relax and take a deep breath. Come on, follow me. Breathe in. Breathe out. Breathe in. Breathe out. You feel better now?
No. Tell me, if I spend the rest of my life in the wheelchair?
Although back pain can be very distressing and debilitating, it is rarely a dangerous and life-threatening condition. Almost everyone will experience an episode of low back pain at some point in their lives. For most, this episode will resolve quickly. For some, however, back pain becomes persistent. Only a small percentage have back pain due to a potentially life-threatening emergency. If you are worried about your back pain, you can seek help from a physiotherapist or a doctor to have a further diagnosis of your condition. This can help you to identify whether you have any serious pathology that requires surgical or medical management, and can help you to understand better about your condition and the steps that you can take to improve your condition.
Moving on to our next slide. We would like to discuss the results of the survey that was carried out for several weeks in order to get to know the prevalence of the circulation of myths regarding low back pain among the public. Upon mutual agreement and advice given by the lecturers, this survey is open for the public who are 18 years old and above, as well as those who have concern, have experienced, or are experiencing low back pain issues. The statements in this survey are the myths on the potential causes, correct way of coping, diagnostic and treatment options for low back pain they will explain just now. We are glad to announce that there are a total of 75 people who have filled in this survey. Alright, let's get started. For the first myth, getting older is a cause of back pain. 57.3% of respondents agreed and 25.3% of respondents disagreed with this statement, while the remaining 17.3% of respondents are not sure about this. This indicates that more than half of the respondents believe that they will suffer from back pain while they age.
However, is aging the cause of back pain?
There might be a controversy or debate over this issue that aging will definitely cause age-related degeneration of tissue or the structures of the back, such as fragility of the spine or muscle wastage or weakness. This is somehow true, but aging is not the primary cause of back pain among elders, and its occurrence can actually be delayed or even prevented.
I agree with you because I've done some research on this topic before. Sometimes back pain experienced by elderlies could be due to incomplete healing of previous injuries, from motor vehicle accidents or sport injuries sustained when they were young. The pain will only start to show up progressively when the structures become too weak to cover the hidden problems.
I see. Then it's really important for us to take better care of our back when we are young to have a better chance to avoid the age of aging.
Yep. Besides, some members of the society hold the opinion that the spines of the older generations are too fragile to be moved, so they are afraid to move or tend to be inhibited by the children to stay active. That's when sedentary lifestyles come in to increase the risk of back pain. Evidence has shown that exercising in a proper technique is actually the best way in the prevention of back pain in the elderly. Elderlies are encouraged to do any form of exercises within their means.
Like walking, jogging, doing tai chi, gardening, hiking, and so on. These activities are actually good for improving their cardiovascular endurance as well.
Yeah, aging is not an excuse to not exercise. Next, other than aging, some people also think that poor posture is the cause of back pain. I was so surprised with the results of the second myth, as there are almost 100%, which is 96% of respondents agreed with this myth, and only 1.3% and 2.7% of respondents disagreed and stayed neutral for the myth respectively. This indicates that developing correct posture has become a common ideology in public for the relief and prevention of back pain. Even for me, I'm always being advised by the elders to sit upright and avoid slouching, and I believe we all hear this phrase while growing up, right?
Yes, it's true.
But we are always informed that slouch posture will increase loading on our back and eventually cause back strain, while upright posture is instead the best treatment that is free of charge.
That's the myth. Most of us have been misled by this frequent false impression brought up by the older generation, self-acclaimed professionals, as well as non-evidence-based practices. While researchers have shown that the link between poor posture and back pain is weak, and there's in fact no single correct postures. Sitting with a hunched back can also be safe for the back as long as we are relaxed with the posture and we keep changing the posture frequently.
Oh, that means it's not wrong to have poor posture. We just have to avoid any sustained postures for prolonged periods. Am I right?
Yeah, you are right. Sometimes people tend to force themselves to be in correct straight posture even though it is actually uncomfortable to be maintained. This will then cause the muscles to become fatigued and tight as they work so hard to hold the back straight for a certain period of time. Feelings of stress or anxiety might also be triggered as well. Believe me, it would just make things worse. The pain that we experience from the back, as a matter of fact, is due to the lack of movement when we are made to move.
I see. Let's get up and do some stretching for a while. We should start practicing this from our own self. Otherwise, we will all suffer from back pain at young age. Pity us.
Alright, the best posture is the next posture.
For the third myth, which is injection, surgery, and strong drugs are effective treatments for persistent back pain. 42.7%, which are 32 from 75 respondents, are not sure about this statement. Meanwhile, 30.7% of respondents agreed and 20 respondents disagreed about this. We can see most of them are not exposed to the correct information about the treatment of back pain. We do agree that injection, surgery, and medication aids in reducing the symptoms, particularly the pain. However, these do not imply that we should be fully reliant on the medication. If we hope to keep the back pain away, Wanji, what do you think the best treatment is?
I'm not sure about it, but I would say exercise.
Yes, there is a lot of evidence that proves exercise is the most effective way to solve the back pain problem. Those who are having back pain can reach out to physicians or physiotherapists for the correct ways of exercise.
So when can the surgery or injection be carried out?
Surgery and injection are the treatments for persistent back pain. The physician will carry out surgery if the patient fails to recover even with the help of conservative treatment.
I heard that there are some external modalities that can help us to reduce back pain, such as a hot pack. What do you think about this? Is this a really good way for us to treat our back pain?
Well, this is one of the ways to reduce the pain, but we should not rely on these two. This is because it only provides a temporary effect and the pain will appear again after the removal of modalities. By the way, we can use this to decrease the pain before we start doing exercises. Now, let's talk about the result of the fourth myth. We should not move if we are having back pain. This is a good result, I would say. Only 10 respondents think that the statement is correct, while almost half of them, 37 out of 75 respondents, agree that this is not a correct statement. This is a wrong statement because moving your body will not worsen your back pain, while it helps you to recover from the problem.
Yes, I'm happy to see this result, but we can also see that 37.3% of them are still not sure about the truthfulness of the myth. What do you think about this?
It is not surprising that they are not that certain about the statement because most of us have the mindset since young that we should try to avoid moving if we experience physical pain in order to not worsen the injury. Also, people around us will always advise us to rest if we are having pain. So we always keep this in our mind without questioning its validity.
Yes, I do agree with that. But as we have discussed before in the previous myth, exercising is actually a good way to solve back pain. This strongly debunks the myth that we should rest if we are having back pain.
As for myth 5, repetitive bending and loading is bad for our back. 65.3% of respondents think that it's a true statement and 16% think that it's false, while 18.7% of them are not sure about it. We can see that more than half of the respondents had a misconception on this statement, where they think that repetitive bending and loading brings harm to our backs.
Well, but it does make sense that repetitive bending and loading of the back will cause pressure and compression to the spine structures, right? Doesn't this prove that frequently doing the movement will be bad for our back?
It is logical if you think about it this way, but in fact, it is actually not. Look, activities that involve bending and loading, such as lifting weights, tend to make our back muscles stronger, while moving and loading makes the back stronger and healthier as well.
Oh, so it means that bending and loading of the spine are actually good for our back? But I did encounter people suffering from back pain after doing this movement frequently.
Yeah, but do bear in mind that our spine is a strong structure. Movements such as lifting, bending, running, and twisting are safe if they are initiated and done gradually and practiced regularly. Moreover, bending our spine is essentially an unavoidable movement that we do in our daily lives, as most of the activities we do will involve bending our back, right? So, need not to be afraid that it will cause harm to our back.
For the sixth myth, the more pain we feel, the more severe the injury is. Based on our survey, 49.3% of respondents think that this myth is true, while 20% of them think that it's false, and another 30.7% are not sure about the statement. Based on the results, we noticed that most of the respondents have the wrong idea about the myth. The pain scale does not indicate the severity of the injury.
So does it mean that this statement is unsuitable?
Yes. Actually, when pain perseveres, it is common that the spine and its surrounding structures increase their sensitivity to touch and movements. In this case, the pain caused during movements or activities actually reflects how sensitive the structures are instead of how damaged they are.
Oh, so it means that the sore caused during movements is actually safe? Not that the injury is getting worse, is it?
Yes, you are right. Even though that pain is aggregated, exercise as an evidence-based treatment is still needed and very important and serve as one of the most effective treatments.
I see. So is it actually normal to feel pain when we conduct the exercise?
Yep, the pain might decrease with time when we gradually increase our activities. In fact, continuously avoiding certain movements or postures that cause pain is not a cure for it.
For myth number 7, 48% of the respondents, which is slightly less than half of the number of respondents, agreed with the statement that scans and medical imaging show the causes of back pain. 34.7% of respondents are not sure, while 17.3% of respondents thought that the statement scans and medical imaging show the causes of back pain is false. It seems that the public is quite well informed about the facts or myths regarding medical imaging.
Oh, are you implying that even if we were to spend hundreds of ringgits on getting a CT scan, we might not even get an accurate or proper diagnosis?
Yeah, right. Generally speaking, if the back pain is contributed by physical pathologies which involve bones and soft tissues, it can be shown in the images such as X-rays or MRIs. However, some of the time, back pain is due to other factors, non-mechanical in fact, which makes it undetectable on images.
Can you explain further the meanings of non-mechanical factors and mechanical factors?
Mechanical factors are situations such as when bones move out of place, soft tissues inflammation, or protruded intervertebral discs, while non-mechanical factors involve psychosocial factors such as negative beliefs and perceptions, poor pain coping strategies, anxiety, fear, depression, and etc.
So how should I know when to get these medical imaging done? Since I don't want to spend unnecessary money and be exposed to radiation, even though it can't help my condition.
Normally, your therapist will only recommend these medical imagings done if they suspect that you are presented with strong evidence to a certain physical pathology which needs immediate attention.
I see. This makes so much more sense now.
Alright, moving on to our myth number 8, which is massage is the best way to treat low back pain. Only 40% of people thought that this statement is a wrong statement, while 22.7% agreed that massage is the best treatment for low back pain. The remaining 37.3% of respondents answered that they are unsure.
Wait, isn't massaging the best treatment? It promotes blood circulation and adjusts the bones and muscle back to their original place.
Well, hold your horses. Massaging does increase blood circulation, but do you know what promotes blood circulation even better?
Exercising, isn't it?
Yes, you're right. Also, massaging does not put the bones and muscles back to their original places. They provide temporary pain relief, but they are not the permanent solution.
Okay, so exercising is the key then. But how would I know what exercise to do?
Well, you can always refer to the medical professionals nearby, especially those who are in the field of physiotherapy. They can provide an extensive assessment and design an individualized exercise program for you, if you are suffering from back pain, that is.
Oh wow, I learned something new today too.
Moving on to the next myth, which is back pain means our bone is out of place. There are 62.7% of respondents agree that this is a false statement, and only 5.3% of respondents think that this is a true statement. And the remaining 32% of respondents are not sure about it. From the responses, we note that most of the respondents were able to identify these myths.
I think maybe they can feel their bones not shifting out of place when they have back pain, so they know that this statement is wrong.
Exactly. Our spine is stronger than we expected. That's why our spine can support our whole body. It's not easy for the spine to be out of place.
Yep. Although there are certain types of back pain that are caused by malalignments such as slip disc or scoliosis, only a small portion of people will experience these problems. There are many reasons that will cause low back pain, and there are about 90% of people who are suffering from low back pain for unknown reasons. However, we have to understand that back pain is not necessarily caused by the malalignment of the bones. The last myth is back pain is dangerous and life-threatening. I was surprised at the result as 46.7% of respondents agree that this is a true statement. That means almost half of our respondents agree with this statement. 29.3% of respondents disagree with the statement, and 24% of respondents are not sure about it. First, most of the respondents have misconceptions about this statement.
So this is in actual fact a false statement?
False statement. I think maybe most of the respondents think that the spine is a crucial part of our body. So if they experience back pain, there might be a higher chance for them to become paralyzed.
Yes, I agree with you. Even my own family members will tell me that back pain will cause paralysis and will shorten their lifespan, especially the elderly that suffer from low back pain.
But aren't there some serious pathologies or conditions associated with low back pain that are life-threatening, like a tumor or infection in the spine?
These conditions are rare, as only a small percentage of people with low back pain will present with these serious pathologies. Moreover, all these conditions are seldom life-threatening if the patients are able to get treatments earlier.
Yep. So for those who have low back pain and worry about their conditions, they can actually go to see a doctor or a physiotherapist to get further diagnosis and treatments on their conditions to recover faster. Don't overthink about it, even though overthinking won't make you feel pain, but it will make you feel more anxious, and the anxiety may deteriorate your condition.
Thank you for your time.
Thank you for your attention.
We hope you learned something new from this video.
Don't forget to share this video with your friends and family.
Please leave a comment and we'll get back to you soon.
Bye.
This exercise is going to help.
Please.
Your MRI scan
It's normal.
Give me back the massage. I think I have to rest for a few days. Sorry.
I even had to talk to you. Oh, my back is hurting. Sorry, my hurt. Thank you for your time.
Thank you.
Thank you for watching.
就你一个。